This is your Minute with the Mayor for Tuesday, July 21st. In Council Bluffs hospitals, there are 50 adult patient beds available, 10 adult ICU beds available, and 36 ventilators available. Currently, there are 6 COVID patients in our hospitals. 3 of them are in ICU units, and 1 patient is currently on a ventilator. We still are waiting for data on new Pottawatomie County confirmed patient diagnosis numbers that include Saturday, Sunday, and yesterday, Monday, from the state of Iowa. The following information was gathered from various news stories as reported in the Cedar Rapids Gazette, the Des Moines Register, and the Iowa Capital Dispatch. In the midst of a pandemic, timely, accurate information can save lives. Since the beginning of the pandemic, Iowa's news outlets have reported on a general lack of information from the Iowa Department of Public Health about the spread of the virus in our state. Last week, the person whose job it was to communicate with the media lost her job for actually trying to do that job. Polly Carver Kim, the lead spokesman for the Iowa Department of Public Health, was asked to resign or risk being fired. She believes that the people she worked with in the governor's office have an adversarial attitude towards the press. She often had been told not to give information to journalists for no apparent reason. Sometimes we legally can't give information, but this wasn't that. It's just disappointing to see this happen, she said. Most journalists are doing their best, and I think the Iowa Department of Public Health is too. There is no reason not to give them answers. In an email that she sent to the Des Moines Register, Carver Kim stated, "I am embarrassed and saddened by the way the media has been treated during COVID. You are not receiving timely answers, and you are getting scripted talking points when you do get an answer." The governor's response when asked about Carver Kim's ouster: "I don't micromanage our agencies. I'm not involved in personnel decisions, and so I was not involved in that decision whatsoever," Reynolds says during her news conference last Friday. The Reynolds administration has now rerouted all public information from the Iowa Department of Public Health through the governor's office instead of coming from the state agency that is in charge of public health. Remember, she publicly declared that she is not involved in micromanaging that agency. In April, the Des Moines Register tried and failed to get a copy of Reynolds' coronavirus response plan. Iowa Department of Public Health refused to release the plan, declaring that it was exempt from Iowa public records laws. In May, Cedar Rapids radio station, KCRG, reported that Iowa was no longer reporting hospitalization rates. Both Wisconsin and Minnesota provide this information in their daily data reporting, and Iowa did too until May, when the data suddenly disappeared from the state's COVID-19 tracking website. The Cedar Rapids Gazette has multiple unanswered open records requests. Iowa law mandates that the state respond to these open records requests within 10 days. But that isn't happening, and it's not just the Gazette. Multiple journalists report the same thing: unanswered emails, unreturned phone calls, and lagging records requests. We don't know how many tests a day Test Iowa is processing. The Iowa Department of Public Health reported an average of 3,181 samples per day over the last 3.5 weeks, but they don't report daily tallies. We don't have individual test data. Test Iowa data is combined with other testing data from around the state, so there is no separate data on how many Test Iowa tests per day are being processed, or how their positive and negative testing rates compare to the rest of the state's testing, which means we still don't know what this $26,000 contract bought Iowans. Iowa Department of Public Health says they can't release this information, but Utah, which uses the same program, is able to get the information. We don't know the hospitalization rate of Iowans from COVID-19. We never saw a full COVID-19 response plan from the governor's office. Beyond Dr. Padati and Deputy State Epidemiologist Dr. Ann Garvey, we don't know which epidemiologist consulted with Reynolds on her pandemic plan, although we do know that she didn't talk to multiple experts from the University of Iowa who had begged her to impose stricter shutdown guidelines. We don't know how many people in meatpacking plants have died from COVID-19. Local citizens have asked me why our data numbers sometimes don't match the state's numbers. One contributory factor is simply that the results are due to timing. I receive my statistics from the Pottawatomie County Public Health Director, and they represent activity from the previous day. But since the inception of the pandemic, Pottawatomie County Public Health has struggled with accuracy in the state's reports. I don't think the state is intentionally misleading Iowans. I believe they have issues with data collection in an established, systematic fashion that enables them to answer questions, test hypotheses, and evaluate their decisions' outcomes. The governor has repeatedly said that her office intends to be transparent as possible about the coronavirus. But for some, it seems the attitude is that if you can't control the disease, then bury the details. The unfortunate reality is that Iowans have to sift through incomplete and ever-shifting data, trying to piece together a sense of how risky it is to venture outside their front doors. That's your Minute with the Mayor. Do something kind for somebody and wear a mask.